Hi, my name is Brooke. I'm a student nurse here at South Alabama, and today I'm going to be performing my medication administration checkoff using heparin. So first I'm just going to show my ID. Then I'm just going to scan the room. Okay. Then I'm going to show what's on my table. Okay. I'm going to fix my camera because it is a little sideways. All right, there we go. All right, so first I'm going to make sure that I do not have any interruptions. So I'm going to keep the door shut. I'm not going to answer any phone calls, and I'm going to keep conversation with my colleagues to only essential information. And I'm going to make sure that I'm following my agency's no interruption zone policy. Okay. So the first thing that I'm going to do is I'm going to verify my medication. I'm going to compare my chart to my MAR. All right. So I have here heparin 5,000 units subcutaneously every 12 hours. And on my MAR, heparin 5,000 units subcutaneously every 12 hours. Okay. And after verifying the medication, I'm going to go ahead and perform my 7 rights. So again, I'm going to verify my medication. I have heparin 5,000 units subcutaneously every 12 hours. Heparin 5,000 units subcutaneously every 12 hours. I'm going to go ahead and verify the correct dose. So we have 5,000 units, 5,000 units, okay, the correct time, so 12 hours, every 12 hours, all right. Subcutaneously is the route, all right. Then we have subcutaneously, okay. And I'm also going to make sure I'm verifying my patient. So I have Jaguar J. Jones, okay. I'm also going to make sure I'm following the correct indication. So heparin is known to be an anticoagulant, okay. And I'm going to also make sure I am following the correct documentation, okay. I will be looking at my MAR and chart for comparing. All right, so next I'm going to go ahead and also assess the allergies. So I see here that I have a penicillin allergy listed, all right, and then penicillin allergy. And I'm going to go ahead and perform hand hygiene. I'm going to go ahead and pick out the medication, the vial that I will be using. All right, so I see here I have the heparin. It says on the vial, heparin 10,000 units per milliliter. All right, I'm going to make sure that I have grabbed the correct one. So I see in my MAR, heparin 5,000 units subcutaneously every 12 hours. All right. Then I'm going to look at the expiration date. We have 12/5/2025. All right, so that is good. Now I'm going to show it to the camera. All right. Then I'm going to also make sure I'm going ahead and verifying the correct time and the route. So the time is every 12 hours, all right? And also I'm going to verify the correct route again. So it's subcutaneously, all right? Then I'm going to go ahead and select the proper syringe and needle used to administer my medication. So I'm going to be using a TB syringe. I have here a 28 gauge, all right? I'm going to show you. Okay. Then I'm going to go ahead and calculate the amount that I need to be giving for my medication. So I see on my vial I have, let's see, heparin 10,000 units per milliliter, okay? So I have my dose written down here for 5,000 units. So that is going to be half of what my vial says. So that means I'm going to cut that 1 milliliter into half. So I'm going to be administering 0.5 milliliters. Okay. So I'm going to go ahead and draw up the amount that I will be using. All right. I'm going to go ahead and remove this cap, but I'm going to keep that safety on. And I'm going to go ahead and clean my vial. All right. All right. I'm going to go ahead and draw back the air. All right, and once I have that, I'm going to go ahead and inject into my vial. Push the air. All right, I'm going to make sure I'm supporting the vial with my hand so it is even. All right, and I'm going to pull back slowly so I do not have any air bubbles, and I'm going to 0.5 milliliters. Okay. Now I'm going to go ahead and put my safety back on, and I'm going to look to make sure I do not have any air bubbles. We have a small one right here, it looks like. All right. All right. All right, it looks to be good. All right, I do not have any air bubbles. All right. Just going to show that I have pulled it back to 0.5. Okay. And after preparing my administered medication, I'm going to go ahead and compare it to my vial and my MAR. All right. So I pulled back 0.5 milliliters. All right. Heparin 5,000 units subcutaneously every 12 hours. All right. And also, if indicated, depending on what medication I have, I would get another nurse to verify my calculations. All right. And once I know that I have that correct dose, I'm just going to go ahead and perform my 7 rites again. All right. So first, I'm going to verify my medication again. All right. So I see here that I have heparin 5,000 units subcutaneously every 12 hours, and I'm comparing to the vial and the prepared medication. Then I'm going to verify my dose, so 5,000 units. All right, and that was half of the 10,000 units we had on the vial, so we administered 0.5 milliliters. All right, then the correct time, so every 12 hours, and the correct route subcutaneously. All right, then I'm also verifying my patient again. So we have Jaguar J. Jones. Then I'm also going to make sure that I'm following the correct indication. So heparin is known to be an anticoagulant, and I'm making sure I'm following the right documentation as well. All right. So after that, I'm going to go ahead and put a label on my syringe, and this label is just going to have the name of the medication, the name of the patient, and the dose. And I'm just going to put this back on here for bringing it to the patient's room, just for a safety precaution. Okay. Okay. I'm making sure I don't put it over any of the numbers that I'm reading. Okay. Putting the name. The dose and the name of the medication. Okay. And once I have this prepared, I'm going to again just compare my prepared medication to my vial and my MAR. All right. So I'm looking at the label I made. I have Jaguar J. Jones, 0.5 milliliters. All right. And then I have heparin, and it is heparin. All right, so I'm going to go ahead and move into my patient's room with my vial, prepared medication, and my MAR. So first, when I get to the patient's room, I'm just going to perform hand hygiene. All right. Then I'm going to go ahead and identify my patient using two identifiers. All right, so first I'm going to look at his name though, and it's Jaguar J. Jones. I'm going to compare it to my MAR, Jaguar J. Jones. Date of birth, 8/25/1963. All right, 8/25/1963. Medical record number, 417-6352, 417-6352. All right. And I also do see that he has an allergy ban for penicillin, and I have on here penicillin, okay? Then I'm also going to make sure that I am doing any pre-assessment that is necessary for the medication, such as vital signs, for example, if I had to take blood pressure or anything like that. All right, then I'm going to go ahead and I'm going to perform my third check for accuracy. So this one is at the bedside, and I'm going to go ahead and perform my 7 rights again. All right, so first I'm going to verify my medication. All right, heparin, 5,000 units subcutaneously every 12 hours. All right, and I'm going to, all right, then I have the dose, so 5,000 units. All right. Then I corrected the correct dose that I'm giving today. All right. And then the time every 12 hours. All right. And then route subcutaneously. And I'm also going to verify my patient again. So Jaguar J. Jones. All right. Jaguar J. Jones is what I have on my label. All right. And I'm also going to make sure that I am using the correct indications. So heparin is known to be an anticoagulant. All right, and I'm also going to make sure I'm following the correct documentation. All right, and once I have performed my third check, I am going to go ahead and perform hand hygiene again, and I'm going to go ahead and put on my gloves and goggles, my clean gloves. All right. All right. And then I'm going to go ahead and raise the bed to a working height, lower that side rail, and I'm going to position the patient, and I'm going to go ahead and I'm going to expose the abdomen. All right, and I'm going to be doing a subcutaneous injection 2 inches from the umbilicus, all right, for the heparin. And I'm going to, once I expose the skin, I'm going to assess the integrity of the skin and muscle for any bruising, okay? And I'm still gonna make sure that he does have privacy, all right? And I'm gonna go ahead and just clean the injection site, all right? Alright, making sure I do not touch my gloves against the skin, inner to outer. Alright, and once I have done this, I'm going to keep it there just as kind of like a place mark as to where I will be injecting. Alright, then I'm going to go ahead and administer the medication. I'm going to pinch 2 inches of the skin, and I'm going to inject at a 90-degree angle because I pinched 2 inches of the skin. Alright, and I'm going to inject slowly. Alright, then I'm going to just apply gentle pressure. Alright, and I'm going to make sure I dispose of my used needle and syringe into my sharps container. Alright. Then I am going to go ahead and reposition my patient for comfort. I'm going to go ahead and lower the bed back and raise that side rail. And I'm going to go ahead and remove my gloves, keeping them facing downward. And go ahead and perform hand hygiene again. And I am going to observe to make sure that the patient does not have an allergic reaction to the medication. And then I would go ahead and document that I gave the medication in the MAR. And I would also document, if indicated, how the patient tolerated the medication, what kind of reaction did he or she have to it. And then I would also, if indicated, go back into the room to reassess the patient and see how they are reacting to the medication after so much time has passed of giving it. And that has concluded my medication administration checkoff. Thank you.